Hello again. This is Dr. Brian Heaberlin here with Lexington ENT and Allergy, and I wanted to talk about nasal stuffiness or nasal congestion today. So during this COVID pandemic, most of us are wearing face masks. I see more and more people come in with complaints that they're having difficulty breathing through their nose. So our nasal passages are separated by some structures. So we have the septum, that is the center divider that runs from the top to the bottom of the nose and divides the right and the left half of the nose. Along the side walls of the nose, we have these structures called the turbinates. You have the inferior turbinate and the middle turbinate, and those kind of hang off the side, and the job of the turbinates is to warm and humidify the air that we breathe. But many times those turbinates are just too large, or the septum is crooked and we can't breathe. The septum usually starts out straight, but during adolescent years it can become crooked. The nose grows sort of from the inside out, and that septum can fold. Plus, nasal trauma can commonly cause the septum to shift and heal in a crooked position. The septum is made up of cartilage in the front and bone in the back, and many times that cartilage or the bone is deviated. The common procedures we do to help improve nasal congestion are to do a septoplasty to straighten that center divider, and often doing some sort of reduction surgery on the turbinates, and there's different methods that one can use to do that. The outcomes are usually very good from deviated septum repair. We all have heard, people in Hollywood or whatever get a nose job and claim it was a septoplasty, but that's really where they've had a rhinoplasty done, external work to try to improve the appearance of the nose, whereas a typical septoplasty done by an otolaryngologist really shouldn't change the appearance of the outside, but really just improve the inside appearance and the airflow through the nose. Patients are typically much more comfortable after a septoplasty. They breathe better during the daytime, and numerous patients tell me how they breathe better at night and sometimes reduces snoring. So there's a lot of benefits from having that repaired if that's what one needs. Now, the nasal turbinates can also be very swollen and congested in people that have allergy problems. So we typically first treat allergies. We'll also use nasal steroid sprays to try to reduce the inflammation of the turbinates. Something also that we run into is people that have started using over-the-counter nasal decongestant sprays. Afrin or oxymetazoline is the most common of those. What those do is reduce the blood flow to the turbinates and the nasal mucosa. It does make you breathe better for a few hours, but after a couple of days, after 3 to 5 days of usage of those decongestants, what happens is the turbinates get this rebound swelling where they're more swollen than they were before, and people start using the spray more frequently, and then they get kind of addicted or hooked on the spray where they're having to use it frequently throughout the day and they can't breathe without it. And that is, the most congested, stuffy people that I see in the office are people that have gotten hooked on those. So although it could give you a bit of improvement when you have a bad cold and it's okay to use for a day or two, I really don't recommend using those kinds of sprays. Now, there are a lot of good nasal steroid sprays over the counter these days. Flonase is one, or fluticasone spray. So you can get some of these things over the counter that are safe, but some of the ones that are decongestant sprays are not good, and so you got to be careful about looking at that. Oral decongestants like Sudafed can help nasal congestion temporarily as well. However, those typically raise the blood pressure, they cause some sleep problems, so they have a fair amount of side effects that goes along with them, and they've gotten much harder to get due to regulation. So if you have a lot of nasal congestion, you can't breathe through your nose, you feel like you're stuffy or suffocating, especially when you lay down at night, I would try a nasal steroid spray, and if that's not working, or if you just want to get evaluated and see what the problem really is, come and see an otolaryngologist. I talked in another video about nasal polyps. Definitely nasal polyps are a huge source of nasal congestion. Chronic sinusitis is another source of nasal congestion. So there's other things besides what I mentioned, but talked about some of the common things, and we're happy to get to the bottom of that for you if you'd like. Thank you.